Hello, and welcome to Health Connections, your guide to healthy living and smarter choices. September is Childhood Cancer Awareness Month. Each year, thousands of families are affected by this diagnosis. To be more specific, more than 15,000 children in the United States will be diagnosed with this terrible disease. While survival rates have improved over the years, childhood cancer remains the #1 cause of disease death in the United States for children. Leukemia, brain tumors, and lymphomas are the most common types of childhood cancers. Today, we'll hear from experts from Miami-Dade College Medical Campus, faculty members from the School of Health Sciences and the Benjamin Leon School of Nursing, who will help us better understand childhood cancer, the progress being made in research and treatment, and the critical role healthcare providers play in caring for children and their families. To start the conversation, I'm joined by Nicole Jacobson, professor in the School of Health Sciences Radiation Therapy Program at Miami-Dade College. Professor Jacobson, thank you for joining us.
Hey, thank you for having me.
Of course. Why is September recognized as Childhood Cancer Awareness Month? And why is awareness so critical from a health sciences perspective?
As you know, every month has a Cancer Awareness Month, and this is for pediatric cancer. Pediatric cancer, thankfully, is not as common as many other cancers, so people may not be as aware of it. So having September be the month for awareness will allow us to hopefully get it out there, and then at this point, it would help research funding and even just for families and people to know about it. It would help cure more cancers in the long run, of course.
Right, so we're building an awareness towards the issue of childhood cancer to just spotlight it and so that people can know about it and hopefully fund programs.
Yes.
Excellent. What are the most common types of childhood cancers that healthcare professionals should be aware of?
There's many different kinds, but the ones that I will focus on would be lymphomas, brain and central nervous system cancers, and sarcomas. So I am part of the radiation therapy program. So for radiation therapists, we would see mostly sarcomas and brain tumors because that is what is part of our care. So that's what we see the most of in our daily treatments.
In children?
In children, yes.
Okay, thank you. How has treatment for childhood cancer advanced in the recent years?
It's been amazing because as most cancers, the care has progressed immensely since I started my career, and especially for pediatric cancers. So what we do now are these cool new types of treatments. It could be proton therapy, and what proton therapy is, when we treat the patient, there is no exit dose, which means we're sparing a lot of the healthy tissue. So. And that's great for children, obviously, because you want them to still have a much longer life to live with all their healthy tissue intact. And then we have another technique called adaptive treatment planning. And what that is the patient would be in the clinic on the treatment table. We would take an image, and then we would replan from that image on the spot right there, which is not something that has been common in the past. But it's becoming more popular now, and it's really targeting and focused. And again, the goal is to always spare healthy tissue while treating the cancer.
Okay, very interesting. Are there any promising areas of ongoing research or new therapies that excite you, that you really feel like are up and coming and you're just super excited about?
Pretty much that adaptive planning that I was just discussing. I had the pleasure of running one of those machines at Sylvester at the University of Miami, and really seeing firsthand how amazing these treatments can be. So they're still working on that and perfecting it, and then having the availability of that equipment at hospitals, which is another part, of the factor.
And I imagine those equipments are expensive.
Very expensive. Yeah, so that's obviously a different story, but it's very exciting that it's happening.
Absolutely. And what are the biggest challenges that still remain in diagnosis, treatment, or long-term outcomes for children?
I would say that early detection is a major issue for pediatric cancers because any of the symptoms that they get it doesn't automatically think, as a parent or someone with them think it's cancer if you have a stomach ache or something like that. So you don't always look further into it. So the cancers aren't caught super early, which can be a problem because you obviously would like to catch it as early as you can, but hopefully that will change over time. And another issue is access to care.
Okay.
So not every center has pediatric treatments.
Right.
So families who may come across this issue may have trouble, having to cross state lines or go to special places for treatment. So there are more pediatric facilities opening up every year, which is wonderful.
Yes.
But access to care is definitely still an issue.
Thank you, Professor Jacobson.
Thank you.
It's time for our first break, but when we come back, we'll hear from another expert about research and treatment advancements. We'll be right back.
Learn and earn today at Miami-Dade College. College graduates earn 56% more than high school graduates and $1 million more in lifetime earnings. A degree from MDC is your path to greater earning power and career success. Choose from hundreds of affordable high-tech and in-demand career programs, including cybersecurity, artificial intelligence, business, and nursing. Learn and earn today at MDC and fast-track your career. Enroll now at mdc.edu/purpose.
Miami-Dade College has career paths in anything you want to be. What's your story? Be global. Be cutting edge. Be inventive. Be investigative. Be a hero. What do you want to be? Be the best. Be you. Be MDC.
Are you ready to embark on your career journey at Miami-Dade College? With an impressive array of options, including 15 baccalaureate degrees and over 160 associate degrees, there's a perfect fit waiting just for you. Whether you prefer in-person, online, or hybrid classes, we've got you covered. As the largest degree-granting institution in the nation, Miami-Dade College is committed to guiding you towards success every step of the way. Discover your path with us today.
Welcome back. In the last 40 years, the overall survival rate for childhood cancer has increased from 10% to over 85% today. Treating childhood cancer involves a combination of surgery, chemotherapy, and radiation to combat this devastating disease. However, support from doctors, nurses, and the community is equally important in the recovery process. Now I'm joined by Dr. Yolanda Nitti, professor at the Benjamin Leon School of Nursing at Miami-Dade College Medical Campus. Dr. Nitti, thank you for being with us today.
Thank you for having me. It's a pleasure.
Of course. How do nurses support not only the child, but also the entire family during treatment?
So nurses are the liaison to the medical team. Right. We're the ones that bring in, we call the oncologist if something is needed, we call the hematologist. We also are involved the social worker and child life specialists who help with therapeutic play. So we incorporate families into that care. We want mom and dad to be involved at all times with the care of the child, the pediatric child. But we also incorporate siblings. Okay. Why do we do that? We do that because siblings always feel like mom and dad are always with this child who has cancer, and what about me?
Yeah, I can see that.
So we do have community outreaches that will help with that, like Gilda's Club here in Fort Lauderdale. And we have other services that we help siblings adapt to what's going on in the interim that pediatric cancer patient is being treated.
Absolutely.
In terms of the child, we use a lot of age-appropriate language, which means that many times when we're doing a treatment or a procedure, we have to be aware that this child is 5 years old and not 15 years old. Right. So in nursing school, we teach our students at Miami-Dade College, Benjamin Leon, how to growth and development, which helps them in how do you do play therapy with a child who's 5 as opposed to 15. Right. How do you do make them draw so that they could actually get away from their fears and show their emotions through drawing. So pretty much family and the child with pediatric cancer, we sort of want them to be as one and incorporate any skills that we have in nursing to make this process a little bit easier.
Yeah, definitely. It's a difficult process, and I can see how siblings and other family members may feel excluded or left out.
Sure.
So it's nice to encompass the entire family in what's going on with the treatment.
For sure. And many of the parents, they feel isolated during that time.
I can imagine.
And they feel isolated because their child's not going to regular school. So, you know, that also the isolation. So we really need therapy for them. Sometimes we need psychiatrists for the family.
Right.
And we need somebody to come in and kind of explain exactly the process and stuff like that.
Yeah, there's a lot of different layers to what's going on when a child has cancer.
Sure.
Of course, the dynamic shifts in all areas. How do nurses help manage the physical side effects of cancer treatment in children?
So we monitor side effects when treatments are done, when medication is given. We have to be proactive.
Okay.
As nurses, we're in the front line.
Right.
We see the side effects before physicians do.
Right.
Because we're there monitoring, we're doing vital signs, we're asking about pain, we're making sure that they have enough pain medication, and if they don't, and they're saying, I'm still in pain, now we have to call the physician again and say, hey, we need to give a little bit more pain medication. This child is just not doing it. So we're really there proactively at all times. We listen to parents. That is very important because parents know their child better than we do. So we have to be there at all times, constantly in the rooms, making sure that we're answering questions and that we explain to parents, you are part of the care.
Right.
I'm going to tell you the side effects of this treatment or this medication. If you see anything, please let us know.
Right.
We might be missing it, or we're just not aware that the child is feeling this way.
Yeah, it's important for the parents to feel heard also and to provide feedback to the nurses and doctors as to what's going on with their own child. So
Sure.
Absolutely, that's great. Beyond physical care, how do nurses address the emotional and the psychological needs of the children and their families?
So emotional needs, we incorporate a social worker.
Okay.
We also incorporate child life specialists that are located in all our hospitals, pretty much.
What is a child life specialist?
Child life specialist is a person that has been trained to do therapeutic play with children.
Okay, wonderful.
And they're age appropriate.
Okay.
So they come in and they'll do drawing with the pediatric cancer patient, and sometimes those drawings, when you look at them, it really talks about how do they feel about what's going on. So it speaks a lot to us.
Yeah, art speaks emotions, right?
Exactly. We also, in terms of emotion, we have to use intuition.
Yes.
The art of nursing is intuition.
Yeah.
And I say that to my students all the time. We have a lot of intuition. We know something's not correct.
Right.
You know, this child's quiet today. That child's never quiet.
And you come in contact with the child so often that you start to notice some of these patterns in children, and
Correct.
you get to really get to know them.
And sometimes we have to sit with them.
Yeah.
Say, what's going on?
Of course.
What can we do to make this better?
Yeah.
So, you know, we deal with their emotional and physical at many times during the day, not just once. We're there at all times.
I mean, it's an ongoing process for them. This is not something that they can just, go home and forget about it and pick up again the next day. It's a 24-hour job. So nurses are definitely very special people. They take care of a lot. How can schools and communities better support children that are undergoing cancer treatment?
So a lot of the schools have done virtual teaching.
Okay.
Sometimes the parent will come and say, my son, my daughter has a virtual session with a teacher online. And so we make sure during that time we're not giving medications and we're not interrupting the teaching. We do not want children to be academically behind, correct?
Yeah, of course.
So what we do is we allow that time for the teacher to teach. Many times children are homeschooled, so parents are doing the schooling and they have that option. And also a lot of programs now have teachers coming to the home.
Okay, that's
so
great.
If the child is in treatment, they can come to them home and academically teach them what they need to know. We really don't want children that are in chemotherapy going to the schools and catching viruses and so on and so on.
Yes.
So that is super important for the mom to know that she has options.
Absolutely.
And the social workers, before discharge, go over those options. There's also something called the survivalship.
Okay, what is that?
Survivalship is when the child is in remission.
Okay.
And when the child is in remission, now they have to learn to get back into society, right? So we have Gilda's Club, Sylvester Cancer Center has, some sort of stuff for parents. We have Nicholas Children, we have Joe DiMaggio, and they all help with the survivalship planning, getting this child, this parent, this family back into society.
Absolutely.
Because they've been isolated
for so long.
And now we need to bring them back. And that's a process. Like, how do you bring them back into school with other children? You know, that causes a little fear because they've been alone studying and so on.
It brings on a whole new set of challenges for the child and for the family.
Sure.
So you walk them
through that. And in terms of community, we have a lot of community outreach. Social workers are very, they're the experts. You know, they're the trailblazers in community service. We nurses do know of a lot of places because of a lot of us, we train, we hear parents come to and say, hey, I'm doing this at this place, so we kind of know what's going on. And we get in services at the hospital about different places that parents can go. So a lot of times, community outreach is there. They're able to go have, you know, parents need actually support groups. And that's very important so that they know they're not the only ones with a child with cancer. There's other parents, you know, they can speak about their emotions and they can tell each other, my son is going through this, oh, my son has to do this. Okay, it's not that bad, this is what happened. And the stories alone create something different for the parent. They feel comfortable. They can, you know, they give each other the phone number and they can call, hey, this is what's going on.
They can share resources as well with each other.
Super important. And we do have a lot of places in the community that this is available to them.
That sounds great. Very good. What gives you hope about the future for childhood cancer care from a nursing perspective?
So in a nursing perspective, the survival rate is pretty high.
Yes.
I have to say, 85%, not bad, right?
That's not bad.
So for me, what gives me hope is that a lot of nurses now in advanced nursing practice, like the NPs, the APRNs, they're doing a lot of courses within the curriculum and they're doing genetics and genomics courses. So we're trying to come in the forefront of this genetic testing. At this moment, there's a lot of research. I have a PhD in research in nursing. And a lot of research is going towards looking at drawing blood and taking that DNA of that cancer and treating that DNA, treating that right on the spot. Not having the child always go to chemotherapy and killing good cells and bad. So the goal in the future of research is to try to do genetic testing. Now, at Miami-Dade College, we do have a health assessment course. What we do is we teach the students how to do health histories. Now, nurses do health histories all the time, but one of the things that we incorporate is a genogram. And the genogram tells the student, we tell the student, do the genogram and see what health issues are in your family. You'll be, go and talk to your family. You'll be surprised what you find. So by knowing health histories and knowing what disease entities are in your family, we can be proactive to that family, right? So this new method of doing pediatric cancer is zoning in on that specific cancer. We're looking at biomarkers that are dealing with that cancer, and we're targeting that cancer, not in a chemotherapy all the time. We don't do, you know, we have to do chemotherapy, but at the same time, we're zoning in on the specific and rare cancers in pediatrics. And that, for me, is better. Children are doing better. They're not having all these other side effects because we're zoning in on the needs of that specific cancer.
You're narrowing in.
Nurses are learning about genetics and genograms. We're learning about genomics. That's the new thing in advanced nursing practice. I'm a graduate of Columbia University, and that practice as an advanced practice nurse, which I'm not at this moment, I have a PhD in nursing research, they're actually doing courses on genetics and genomics, which is now for nurses to be in the forefront of that. We need to do more genetics, and not only in the pediatric world, but in the adult world. Because this is how we're gonna know what is in our DNA that we could do preventive treatment.
It's gonna indicate what you need to hone in on.
Exactly, and understand this is in my family, you know, kind of know what's going on.
Absolutely.
So it's super important.
What does the medical campus, professors and students do to help build awareness and support within the community?
So we have a community nursing course that we actually do when we're doing our specialties, which is OB, Peds, and Psych. And what we do in that course, we have students go out to the walks for cancer. Sometimes a student will be very involved, and she'll collect $1 from each student and then donate the $1 and go there and help awareness of the cancer, pick up the signs, help, you know, American Cancer Society. We help them with preparing the site for the walk. So we do a lot of walks for that.
Okay, and getting donations, I'm imagining, too.
Exactly, and we help with donations in terms of the students are the ones that really are doing the donations within themselves.
Okay.
You know.
So they kind of take the lead on the cancer walks in setting them up and in doing donations and getting awareness built within the community. Okay, very good. And do nursing students typically get trained in pediatric cancer specifically?
So at the level of the associate degree nurses, we do a general pediatric course.
Okay.
But part of the course is to understand the different types of cancer. Okay. With that said, if the student is interested in actually going into and learning about pediatric cancer and working in pediatric cancer, then they apply to the hospital.
Okay.
Once they apply to the hospital, the human resource person then asks them, well, where are you interested in working? And they'll say, I really want to do pediatric cancer. So they put them on the units. They have to be on the units for a while to learn about pediatric cancer, the emotional effect, the psychiatric, and sort of the whole component of being a pediatric cancer nurse, right? And one of the things that is required is that those nurses who go in there have to be chemotherapy certified.
Okay.
So they have to do an extra certification that we do not teach in the program, but it is something extra that they have to learn while they're working on that floor.
Got it. So they would have to sometimes get additional training or additional certifications after they finish the program to be able to physically work with
to truly be the pediatric cancer nurse.
Okay, perfect. Thank you so much, Dr. Nidhi. That's all for this edition of Health Connections. For more information about the services provided at the medical campus, please call 305-237-4000 or visit us at mdc.edu/medical. Remember, healthy choices lead to healthier lives. I'm Laura Vanzal. Until next time, thank you for watching.